even during this painful week, we see glimmers of very, very strong hope. And this will be a very painful week. And next week, at least part of next week, but probably all of it. Look, if one person dies, it's a painful week. And we know that's going to unfortunately happen. This is a monster we're fighting. But signs are that our strategy is totally working. Every American has a role to play in winning this war. And we're going to be winning it. We're going to be winning it powerfully. And we'll be prepared for the next one, should it happen, but hopefully it won't. Our massive airlift operation for critical supplies, it's called Project Airbridge, continued today as 5 massive planes, flights landed in the United States packed with personal protective equipment. And our nation's heroic healthcare workers will be the beneficiaries of that. 27 more flights are scheduled in the near future over the next couple of weeks. The Army Corps of Engineers is constructing facilities that will support more than 15,000 hospital beds to treat patients in need. So they're building now approximately 15,000. They just completed the big one in New York. They just completed and are in the process of continuing in Chicago and many other places. They're incredible. The Army Corps of Engineers, we owe them a lot. What they were able to do in such a short period of time. They'll build these massive facilities, 2,000 beds in 4 days. So it's really something very special. I know I was in the construction industry, and you don't see that happen very often. I want to remind governors and emergency managers that sharing real-time data with us about equipment and their needs is very important. All of their supplies, hospital occupancy is critical. A lot of the occupancy is really getting a little bit lower than anticipated, and that's good. We sort of thought that was going to happen. And we're getting along very well with the governors. This whole situation with respect to talking to us about equipment and equipment needs, giving us a little bit of lead time, so important. All the supplies, we're getting it to everybody like they never thought possible, but will ensure that we can rapidly deploy federal assets where and when they're needed, especially on ventilators. We're actually getting some ventilators back. As you know, the state of California was great. They sent some back, which they won't need, and Washington State likewise. And we have some others coming back, so we're using them in areas we need them. We are pressing forward aggressively on the scientific frontier of the medical war. The companies I've spoke to, the 4 leading, I call them the genius companies, they're doing incredibly well with respect to cures and also with respect to a vaccine that's going to protect us, totally protect us, and they have some great potential. It's going to take a little while yet, but they have some great potential, some great early results. And the governor's been working hard, and we are working hard with the governors. There's been great coordination, especially over the last little while. We're giving them a lot of equipment, a lot of ventilators, but a lot of equipment of all types. And I will protect you if your governor fails. If you have a governor that's failing, we're going to protect you. But the governors are working well with us over the last period of time. Today, in our stockpile of ventilators, and again, we need the stockpile so we can immediately move them from place to place wherever the monster hits. It's a monster. We have 8,675 ventilators right now in stock, ready to move. And we have all sorts of incredible soldiers. Our military is going to move them should they be needed in, as an example, if we need additional in New York or the New York City area. You have state, you have city, and spoke to Mayor de Blasio, and we really have a great, well-coordinated campaign with Mayor de Blasio. It's been really good. Spoke to Governor Cuomo. There's been great coordination. So if they need something, we have it. If Louisiana needs something, we have it. Same thing with Michigan. Same thing with Illinois. There are certain spots that are very hot, and we'll see what happens. But we'll know pretty much. We'll have time, and we'll be able to move it. In addition to the 8,675 ventilators, We have 2,200 arriving on April 13th. We have 5,500 arriving on May 4th. These are ones that we're building for the most part. And we have, as you know, great companies building them. Ford, General Motors, GE. We have really some great companies that are doing it. On May 18th, we have 12,000. On June 1st, we have 20,000. On June 29th, we have 60,000 ventilators coming, 60. So we have a total of 110,000 ventilators coming over a short period of time. I don't think we'll need them. Hopefully we won't need them. I don't think we'll need anywhere near them. But we'll have them for the future, and we'll also be able to help other countries who are desperate for ventilators. The UK called today, and they wanted to know would it be possible to get 200, and we're going to work it out. We got to work it out. They've been great partners, United Kingdom, and we're going to work it out for them. So they wanted 200. They needed them desperately. We now have 10 drugs in active trials, with 15 more soon to follow, as well as 2 vaccine candidates in active clinical trials. We'll do whatever it takes to secure needed medical supplies and bring more production of essential medicines back to our shores. We're doing that. We're bringing them back to our shores. A lot of these companies, they went a little bit haywire. They went away from this great country, and they had them produced elsewhere. So we're going to start bringing them back. And I've been talking about that for a long time, not only with medical, but lots of other things. America continues to perform more tests than any other nation in the world, and I think that's probably why we have more cases. Because when you look at some of these very large countries, I know for a fact that they have far more cases than we do, but they don't report them. We've performed 1.87 million tests to date, so that's 1,870,000 million tests. Think of that, 1,870,000 tests to date. And now we're performing them at a level that nobody's ever seen before. As we announced yesterday, CVS testing sites in Georgia and Rhode Island will be using Abbott Labs' rapid 5-minute test. We're down to now 5 minutes. It's a 5-minute test so that people can get their results back very quickly. And we're actively engaging on the problem of increased impacts. This is a real problem, and it's showing up very strongly in our data on the African American community. And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot. But it's been disproportional. They're getting hit very, very hard. In fact, while we have Tony here, I'd like to maybe have you come up and address that one, and then I'll continue. But if you could address that, it would be great, Tony, please.
Yes, thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you, Mr. President.
Thank you very much. And Tony, I think you're going to have some pretty accurate numbers over the next few days, right? But they are they're very nasty numbers, terrible numbers.